Through my education with Bryant Stratton College, I feel I have gained enough knowledge to be successfully employed in a position as a medical coder. They have prepared me in every way to begin my new career. Every class along the way has given me a new skill or refreshed ones I already had. I started with a refresher course in medical terminology and anatomy and physiology. Although I am currently a nurse, it is always good to review and reinforce information. A good understanding of medical terminology is critical to being a successful coder, as well as knowing the common and medical names of body parts and procedures. You cannot spend all of your time looking up definitions. In math, I learned how to analyze and organize data and used inquiry and reasoning to form conclusions and make decisions. As a coder, I will constantly need to do these tasks. I will need to be able to take a file and extract the relevant information to code and determine what is missing and be able to find that information elsewhere. In computer skills, I also received a refresher on Microsoft programs such as Word, Excel, and PowerPoint. I have done several presentations over the course of my education utilizing PowerPoint, as well as doing numerous video presentations. Research and writing, along with information literacy, taught me how to use reliable resources to search for information and how to put that information together professionally and presentably. You have to be able to communicate effectively, both verbally and in writing, to be a successful coder, as you are interacting with doctors, nurses, other coders, insurance companies, etc. on a daily basis. Coding compliance and ethics was a very important class, as we need to be aware of the ethical issues in coding with everything we do. Ignorance of the law is not an acceptable excuse if you do something unethical, unlawful, or fraudulent. You need to be aware of the rules and regulations of the various agencies you will deal with, as they are constantly being updated, as well as the privacy rules established by HIPAA. Through physician-focused coding courses in diagnostic coding, evaluation and management, and healthcare common procedures, I learned how to utilize the different coding manuals. With the ICD-10-CM manual, I know how to look up diagnosis codes using the main terms in the alphabetical index, how to reference the coding conventions and guidelines, and how to code to the highest level of specificity. I understand that medical necessity drives everything, and that everything must be supported by documentation. Just like in nursing, if it isn't documented, it didn't happen. I also know how to utilize the codes for assigning external causes of injury, the activities being performed, and the place of occurrence. I am proficient in using the table of drugs and chemicals, as well as the neoplasm tables. Through the use of the CPT manual, I can accurately assign evaluation and management codes. After determining the place of service and whether the patient is new or established, I can determine the correct level for the visit using the 1995 and 1997 documentation guidelines for the history and exam, medical decision-making, counseling, coordination of care, nature of presenting problem, and the time spent with the patient. We also learned how to look up CPT codes for anesthesiology, surgery, radiology, pathology, lab tests, and specialty services listed under the medicine section. Also covered were the use of modifiers and when and how to apply them, global service packages, coding for durable medical equipment, drugs, and their administration. I understand the flow of information, starting with the patient experience all the way through carrier payment. We learned about encoder programs and electronic medical records and the pros and cons of each. We listened to advice from experts such as coders, office managers, billing and insurance specialists, and compliance officers, and used their advice to analyze risks and problems that arise in coding. We worked on time management and how important that is with respect to coding, as there are time limits involved in submitting claims, and time needed to gather missing information through physician queries. We discussed cultural diversity and how cultural sensitivity plays a role in the workplace in our dealings with patients and other professionals. All of this learned information was reinforced through writings, coding exercises, case studies, and projects that utilized the skills attained and put them into real-world situations. With my background in customer service, management, and nursing, and now in education in medical reimbursement and coding, I feel that I would make an excellent coder. I'm a quick learner, I ask a lot of relevant questions, and I am very organized and manage my time well. Thank you for your consideration.